Well, no, the problem here is an extraordinarily low ovarian reserve, which sometimes occurs in older women, and the follicles are empty. In other words, you form a follicle, it makes estrogen, but towards the end of your reproductive career, so to speak, uh, you have way less eggs in the ovarian cortex. So here's the way that works scientifically. When you have a lot of eggs, the ovarian cortex is just stuffed and filled with primordial follicles. Recruitment occurs 4.5 months before the ovulation or before the eggs are sensitive to hormones. 4.5 months, and it's not hormonal. They're recruited from that area on the periphery of the ovary. They're tiny little primordial follicles, and there's 200,000 of them in the average young women and teenagers. And they take 4.5 months to develop and become hormone sensitive. Now, what really regulates where they're recruited from or when? It's a circular phenomenon and it's pressure mediated. So if you have a homogeneous, huge amount of eggs all over the cortex, it doesn't really matter. Every cycle you're going to have follicles that have eggs in them. But if you only have a few eggs left, it'll be spotty. There'll be some eggs, some primordial follicles there, some primordial follicles there, some there, some there. But there'll be a lot of kind of dead space, so to speak. And if the recruitment from the periphery occurred from an area that didn't have eggs 4.5 months earlier, then you're unlucky and there is nothing in that follicle. So these things only happen when there's an extreme dearth of follicles remaining in the ovary. But the next time you try it, there may very well be several eggs, several follicles with good quality eggs, because it just depends on where in that periphery, in that cortex, 4.5 months earlier, which you can't detect, the follicle recruitment began from. So now, in terms of complex cysts, those are just corpus luteum. Whether you had an egg or didn't have an egg, you develop a corpus luteum that makes progesterone after the trigger. So those will all go away, and with the normal birth control pill suppression that we would put you on before doing another Mini-IVF cycle, those will all go away. And if they didn't go away, they're not a problem because progesterone doesn't have any impact on ovarian stimulation. The progesterone only would have a negative effect if it messes up the timing of the uterine lining for implantation. So don't worry about those cysts. They'll go away.